the semaglutides, or semiglutides, as I've heard some people say, which is probably not proper, but whatever. It's a GLP-1 drug, a glucagon-like peptide. What is glucagon? Glucagon is a hormone we have in our body that tells the liver when we start to have low blood sugar, says, hey liver, let's kick some sugar out into the blood system because we need to bring that blood sugar level back up. That's what glucagon does for us. So the GLP-1 drug is going to have that response, and it will slow gastric emptying, which then reduces your appetite. And that's why people use it for weight loss, because it keeps you feeling full and you don't want to eat. Now, is that a good thing? It can be good, as we know, for people who are suffering from obesity, and also these GLP-1 drugs, which they were initially meant for, was diabetics. And so we know that they help diabetics as well. So they're good tools for diabetes, and they're also good for people who are really overweight. For people that are not struggling with their weight, it's more of a vanity thing. Yes, they can lose weight, but is it worth it? There's a lot of side effects that come with this drug, with this medication. And then you can tell too that it's a cash cow, because it went from Ozempic to everybody and their brother having their own ideation of this medication. You see it Wegovy, what is it, Trulicity, yada, 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 all these different ones. And then you also see it popping up on Hims, on Hers, all these subscription services. They all have it. So you know it's a huge money maker. And the better thing for you to do, and this is me from a personal trainer, nutrition coach standpoint, is to change your lifestyle. Get the proper sleep, proper nutrition, and exercise. Those are the keys. You will be shocked at if you can just get yourself to change your ways, change those evil ways, you might not need any medication like this. And you know, people are always suspicious about medications, but if you promise them that it's going to drop weight, all of a sudden they could care less about anything. But you know, you tell them something else and they freak out. Threaten government conspiracies, yada, yada, yada. But with a weight loss drug, hey, they're all in all the time. So I don't like it, but I do know that it does work for weight loss. It's been shown, so I can't argue that. And we know it's great, a great medication to use to help out diabetics and people who are obese. It's really a helpful tool. So I'm not poo-pooing it, but I am going to tell you, check with your medical provider, your general practitioner, whoever you see for your medical needs. Check with them first to make sure you're getting your lab work done anyway, and that all your other hormone levels are optimized before you even think about this. You'd be surprised. Just tweaking your hormone levels might help you out. That, getting sleep and eating properly. So don't just jump onto this just because it's the easy way out. It's not the easy way out. There's too many side effects. Abdominal pain, pancreatitis, diarrhea, constipation, thyroid cancer, endocrine issues besides thyroid. And if you have a family history of those, they're not going to want to prescribe it for you anyway. It's just too dangerous. So there are a lot of things that have the negative impacts could possibly outweigh the benefits. So that's why I say try to change your ways, try to change your eating habits, try to get your sleep. Do things like that. I know it's not easy. That's why it's called a little bit of work, right? You got to put a little work in there. So let's talk though real quick now about injectables versus the sublingual. They also have a nasal spray, but I hear that that's not very good at all. The sublingual, the drawback to the sublingual is that you need to take it first thing and on an empty stomach. No drinking, no eating, and you need to hold it under your tongue for 90 seconds minimum. 5 minutes is actually recommended. And then you swallow whatever's remaining. The problem with not holding it under your tongue long enough is that you'll break it down inside your digestive system and it won't be very efficacious. Is that the right word? It won't work well. Okay? It's not going to work as well. An injectable goes right in. Inject it once a week. It's in the system, subcutaneous. They come in these little pens. Not this little pen, but they come in pens. You take the pen, you stick it there, and you give it a little, you come in at an angle, you stick, twist, plunger, It's easy, and it's all measured out. And they come, I think, in 2 or 3 milligram doses. If I have that right, I'm not sure. Check that out. But anyway, it's a real easy type of system when you inject it. But if you don't like needles and you don't want to feel that once a week, and you'd rather just take it via sublingual method, that's okay. It's just going to take a little bit longer to build up in your system from what I've been told by the pharmacy. They say it may take maybe a month before you start seeing some results. Maybe a month, maybe a little longer. So you have to be patient with that one. Don't think it's going to happen overnight, but when it all of a sudden starts happening, apparently it's a quick drop. All of a sudden you'll drop 20 pounds. Now let's talk about this other side effect, and this is the one that bothers me the most. It's the muscle wasting. So people who are using this and they don't exercise regularly, and when I say exercise, I'm talking about resistance training, making your muscles work, putting yourself under some kind of stress from either bands, body weight, weightlifting, whatever, but some kind of resistance training, progressive overload, right? That's what we want to do, so we build muscle. And as you age, your body is already going to go into a point of sarcopenia, which is muscle wasting, and you're going to be fighting that. And you need to have strong skeletal muscle because your system, made up of your skeleton and your muscular system, the whole human movement system is dependent upon you remaining strong with your muscles and your bones, and of course your nervous system. The GLP-1, if it does muscle wasting and you're not somebody who likes to exercise and do any resistance training, you're going to suffer from muscle wasting, and you're not going to get it back because as you age, it just gets worse. That's why you see elderly people, they start to shrink in. We don't want to shrink in, right? We want to stay as strong as we can. We want to have strong legs, strong glutes, strong back. We want to be able to perform until we die. So be very careful with this. That's why I say make sure you're really checking with your doctor. I'm not a doctor. I'm a nutrition coach and a personal trainer. That's what I do. And that's why I'm just giving you some information that's readily available out there. This is only information. You take it, go talk to your doctor about it, and then you'll know if this is something, using a GLP-1 is something that's good or a right choice for you, okay? So the main thing with that I want you to take away, though, is you don't have to inject if you're afraid of needles. You can use a sublingual. It's okay. You'll still get the same benefit. You're still going to have to watch out for the same side effects, so many of them. And you just have to be more patient when you're using a sublingual. But those are the main things. Those are the takeaways I want you to have. And I want you to check with your doctor, and I want you to be healthy. If you have any questions, feel free to comment below, like and subscribe while you're here. Thanks.